Hey guys, popping on to talk about panic attacks today. So, panic is one of those really strange things that a lot of people experience and they feel like they have no idea where it's coming from. But what I have found as a therapist for over 20 years is that when someone comes in with panic attacks, if we sit and really unpack what was going on for them at that moment in that situation, what their vulnerabilities were, and so on, we can figure out where it's coming from. Now, for some people, there may be underlying medical conditions that are going on, like hypoglycemia or some thyroid issues. Those can approximate the same physiological arousal in the body as anxiety. So you definitely need to rule those things out, check vitamins and minerals and all of that stuff with a functional provider. But beyond that, once you have a panic attack, if you sit and dissect where it's coming from, what the vulnerabilities are, you can gain control over it by understanding where it's coming from. That decreases your anxiety. You engage some cognitive behavior therapy skills, and you can overcome the panic attacks. People are cured of panic all the time. So it is possible. So if we look at the DSM, which is the diagnostic manual that clinicians use to diagnose things like panic disorder, anxiety, depression, and other mental health issues, there are several different criteria that a person has to meet for it to be considered a panic attack. And then the intensity is that it peaks within a few minutes and then it's gone. There may be some residual anxiety or some leftover stuff going on, but the panic attack peaks within a few minutes and then it's gone. So if you are experiencing panic, what you want to do is work with someone to really think about and figure out what it is that was going on for you at that moment. So for instance, I've had more than one patient who had their very first panic attack while driving. And now they have issues, or subsequent to that, they have issues with driving. For some people, it's, they have trouble driving up mountains now because that's where it happened. Or they have trouble driving a certain distance from their home because that's where it happened. Or they have difficulty driving in traffic once traffic gets to a certain level because that's where it's happened. So the brain is a wonderful and amazing thing. It is amusing sometimes too, but it's a wonderful and amazing thing. But sometimes it works against us. So it's really good at forming those connections. And what you have to do is convince your brain, I call it reprogramming your brain, to understand that it's not the driving or the whatever that's making you have a panic attack. It's all of the vulnerabilities and everything going into that. And then maybe you experience some normal anxiety while you were driving in traffic, up a mountain, whatever. And then that was what I call the tipping point. So then that pushed you into a panic attack. So let's look at an example. So I've had patients, let's talk about the one driving up the mountain. So she would drive all over the place, no problems, no issues. One time she happened to be driving up the mountain up north and she had a panic attack. So then it became associated, her panic and anxiety became associated with that drive. And then unfortunately, hers just in her brain, it extrapolated it to all other driving situations. So we did some different things with looking at vulnerabilities, managing those, some cognitive behavior therapy. And then at one point I even was like driving with her while I was on the phone kind of thing. So just talking her through that. So all of that to say you can overcome it. But what you might consider in terms of vulnerabilities are various things. So a lot of it has to do with environment. What's the temperature? Are you too hot or too cold? Are you hungry? Or are you to the point where you're hangry? So you're so hungry that you're agitated, irritable, angry, and that can affect you. And then the blood sugar drop that comes with that can affect you as well. So those are a couple of vulnerabilities. If you have a lot of stress going on at work, that can be a vulnerability. If you're fighting with your spouse or your kids are out of control or having issues at school or whatever, these are all vulnerabilities. And so then you get into a situation where you're driving down I-10 and let's say you see an accident or you're aware of, recently there was a shooter on I-10 or something tragic like that. Well, your brain is not actively involved in those things, the accident or the shooting, but it's processing it as a stressor. And so then you take all these other vulnerabilities and now you've hit your tipping point. So it just so happens that you're cruising down I-10 at about the 202 and wham, you get hit with that panic attack. So again, the important thing is to look at all of the things that are going on in your life and how those could be contributing. Of course, manage those, gain control over those. The awareness itself gives you some control, so that's good. And then beyond that, work on the self-talk that you use before you even back your car out of the driveway, and you get into a routine of what you're going to say to yourself no matter where you're going. And then you just practice this. So you used to drive normally before you started having panic attacks, right? Well, there's no reason you can't get back to that place. It's just a matter of reprogramming your brain. So if you have panic attacks, maybe they're not associated with driving. They can be associated with all measure of things. But if you have those, I just want you to understand there is hope. And secondly, there is a very specific procedure and process that you can use to overcome them. Let me know if you have any questions. Thanks.